Okay guys, JumpStart time, Tuesday, thoracic spine. Let's open up that mid back. It's a follow along, so let's get it. So let's get things moving. We're gonna start with some jumping jacks. This is just trying to get the blood flowing, wake you up a little bit. So just get moving, go at your own pace, try to get the blood flowing. Twenty more seconds. Really try to land softly, try to get the ankles and calves to open up, get the shoulders to move, work on your breathing. 5 more seconds. Now we're going to do a lunge with a twist, trying to wake up those knees and then combine it with some thoracic spine rotation. If this hurts your knees, just step and lunge as low as you can. Go slow. 20 more seconds. Breathe out when you rotate. Good job. 5 more seconds. Next, we're going to slow it down and we're going to do a Spider-Man with a twist. The back knee is going to be down. You're going to rotate, take a nice deep breath in. When you expand the chest, when the arm goes up, breathe air in. Now I'm going to make it a little harder. You're going to bring that knee off of the ground. You should feel a nice stretch on that back leg and hip flexor. Switch sides. We're going to start with the knee down first. If you can, squeeze that glute on that back side. Now try to lock out that knee, bring the knee off the ground. Good job. Now what we're going to do is just reach real tall, grab the wrist, pull, and then laterally flex to one side. You can also try to push out that hip. That this side will be your left. Try to stretch out the whole from the shoulder, armpit area, all the way down to the hip. Let's go ahead and go to the other side. Grab the other wrist, pull, nice deep breath. So try to, whenever you breathe out, try to go further into that stretch. Just kind of go back side to side, just to kind of clear everything out. About 5 more seconds. Good. Now what we're going to do is go ahead and grab your foam roller. Go ahead and put it between your shoulder blades. And we're just going to do the basic thoracic spine movement. So you're just going to roll up and down on that mid back. You can bring your arms across your chest to move that shoulder blade out of the way. We're just trying to open up that mid back just so it can help with your posture. Now what you're going to do is put your butt on the ground, support the head, and extend back over the foam roller. We're going to try to do one vertebrae at a time. When you typically open up, you breathe in. When you come back up, breathe out. Now roll the foam roller about an inch or so up toward the head and work on some new segments. And then just slowly start working up to the top of the shoulder blade. Now what we're going to do is bring one arm across your chest. We're going to work between that shoulder blade and the spine. Lean to your side and just gently roll up and down on one shoulder blade. You might feel a little knot, stop on it, and move your arm around. Do the pin and stretch technique. Remember to breathe, try not to hold your breath, and have tons of tension in your back. Switch to the other side. Other arm across your chest, lean the other way. There again, go slow. You're scanning that tissue. If you have a knot, stop on it and move the arm around. Pin and stretch. Get that knot out of there. 10 more seconds. Good job. Now lean to your side. We're gonna work the lats. So that's gonna be from your armpit down to the side of the rib cage. You can stop and do your pin and stretch, hold that tight tension, and then move the arm around. A lot of the tension will be on that back side of the shoulder blade. Good. Let's switch to the other side. We've got 30 seconds. Use your knees that are bent closer when they're on your side, knees high. That's going to help you use that movement to just flex and extend your knees to roll you up and down on the foam roller. Good. 5 more seconds. Remember, try to breathe. Now we're going to lay face down. You're going to bring your arm straight out to the side, and we're going to hit your pecs and your bicep area. I like to have thumb down and thumb up. Just kind of feel where that tight tension is in that front part of the shoulder going into your chest area. This one will get really tight if you sit a lot throughout your day. You can go hand behind the back if you can and just work on that front shoulder. Go ahead and go to the other side. Good. This is there to help warm up that shoulder joint. Now get that front shoulder only. 5 more seconds. Now we're going to do the open book. So bring the knees nice and high, hands palm to palm, and open up that mid-back. Always try to follow the movement with the head, so your eyes follow the hands. When you get to the end, take a nice deep breath, let it all out. Now I like to add a little bit of shoulder movement at the same time, so push your palms into the ground whenever you're doing a good arc of the shoulder. Like to hold the knee down that's on the top. If your lower back is tight, it'll come up with you. Now a lot of times you want to focus on thoracic spine rotation, so you can hug the rib cage and help pull it along to get more of the thoracic spine rotation. This should be a nice, relaxing move. Breathe. Switch to the other side. Knees nice and high, rotate again. If your lower back is tight, try to keep that knee down. Take the movement with the head. Eyes should make the movement happen. Nice deep breath. Then do the push into the ground, do the shoulder movement. If you feel an area of that arc that's tight, stop your hand there and breathe into it. You can also hook the ribs and try to rotate just the rib cage instead of the shoulder. Sometimes the shoulder movement can give you a false sense of good mobility. Good job. Lat stretch. You're going to get a chair, a platform, something, a bed. You're going to do one arm at a time. You're going to straighten your arm. You're going to try to let the lat from the armpit down to the hip, that muscle, you're trying to stretch it. So this is going to have one hand go across the body, hold that tension, kind of pull it, and see if you can sink further to the side to stretch the side of the rib cage. See how I'm leaning to one side? Breathe. You already foam rolled this area, now you're trying to stretch that motion even further. We are isolating the lats right now. The next transition is the prayer stretch. So stay where you're at, and now you're going to put your elbows on the bench platform, put your palms together, and then push down your mid-back to the ground. Elbows should go to the sky. Work on your breathing. You can even push your elbows down into the bed or platform, so you're contracting really hard, and then you're allowing it to pull that movement even further. So push, 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 and then relax. Get deeper into the stretch. Push, 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 and relax deeper into that movement. Feel the thoracic spine move. 15 more seconds. Work on breath and depth. Good. 5 more seconds. Next, go ahead and go onto all fours, grab your foam roller, and we're going to do a thread the needle. Hand on top of the foam roller, and you're rotating as far as you can with the foam roller and breathing out. Good. Then when you come back, breathe in, breathe out. Get a good, nice thoracic spine rotation. At the end range, you can pause and try to see if you can go deeper into that movement. Keep rotating, breathe. Good. Now put your hand on the ground, put it on the back of the head, and now you're going to do the same movement, but you're going to focus on the other end range. This is called a thoracic spine rotation strengthening exercise. Really try to push that arm down into the ground that's on the ground, and try to bring the elbow as high as you can to the sky. Breathe in when you open up the chest. Good job. 5 more seconds. Good. Now let's switch sides. Move the foam roller to the other side and thread the needle. Good. Work on that in range of motion. Breathe out. Good. Breathe out. You're working on one end of the thoracic spine rotation. And then when you do the other strengthening movement, you're working on the other end of the thoracic spine movement. Now work on the thoracic spine rotation. Hand on the back of the head, elbow to knee, breathe out. Then when you breathe in, elbow to sky. Work on in range. Really try to open up. If you need to, you can push down with that hand to help you get a little bit of tightness in that shoulder girdle. Good job. 15 more seconds. Keep going. 5 more seconds. Now we're going to lay face down on the ground. We're going to do a prone shoulder arc movement. All you're doing is doing like the thoracic spine rotation open book, but you're doing both arms at the same time, laying face down. Try to see if you can have your hands stay off of the ground when you're doing this swimming type movement for the shoulder. Nice and slow and controlled. Tuck the chin, bring the head up. This works on cervical spine extension and posture. If this hurts your back, squeeze your glutes and try to flatten out the back instead of arching it. This one will help open up the shoulder girdle, neck posture, and mid-back posture. Don't skip this one. Good job.
So good job, you just got done with the hard part. Now remember, JumpStart is a 4-step process. You did hard part number 1. Next, hey, review those goals that you did last night, okay? Number 3, Write down 3 things you are grateful for. It helps with you, I know this is weird, but it kind of helps you stick with your health goals. We'll put the link down below for the Harvard study. Then, prepare your meals for the day. Hopefully you already did all that on Sunday. Just take it to work with you or take it wherever you're going to be. Success. Remember, discipline is the foundation upon which all success is built. Lack of discipline inevitably leads to failure. Good job.